very serious illness. And every year with seasonal influenza, more than 30,000 people die. So we always have deaths with influenza. And so it's a balance. We want people to take it seriously. We want to not just go into work when we are starting to have symptoms or go to school. We want people to stay home. And we want people to use respiratory hygiene by coughing into their sleep and washing the hands and using alcohol-based hand sanitizers. I mean, this is real important because even though most of us, and we're all vulnerable to this strain of virus here in this room and on the telephone, none of us have seen this before, so we're all vulnerable. Most of us, or all of us, if we get infected, will have a usual course of flu. We're going to feel really bad for 3, 5, 7 days. We'll miss some work, but that's it. We might not even have to go in to see our healthcare provider. But there's a few who are going to be very vulnerable, and we don't always know who those people are. For example, this 10-year-old child. And so that's what's so important in trying to prevent the spread, and to really pay attention to that. And then as soon as we have a vaccine available, we hope sometime, perhaps as early as October, that we get that vaccine out to the people who really need it.
Can you talk
who really needs it?
And Laurel Woods here from our immunization program, and I may look to her to make sure I'm not misspeaking. I think that we are still, the Centers for Disease Control is still working with the high-risk groups that are going to be targeted for the vaccine. But right now it's the very young, under 3, 4? Under 24, but they've honed it down, I think, even lower than that for initial low amounts of vaccine. Is that not right?
Not specifically.
Okay, so that's what I think they're still working on. So anyone from under the age of 24, as well as pregnant women and individuals who have underlying health care problems, particularly cardiac and pulmonary health care problems. So it's going to be sort of targeted, very similar to what we see when we read about who are the high-risk groups for seasonal influenza.
So when you say targeted, you mean you will be giving these people the vaccine first and then others come along? Or, I mean, what will the process be like?
Laurel, do you want to, I know I'm calling you up at the spur of the moment, but Laurel Wood is our immunization program manager, has been working really closely with all of our partners in developing our strategies for vaccine distribution.
Thank you. That's okay. The priority groups that have been named by the Centers for Disease Control were named at the end of July by the Advisory Committee for Immunization Practices. And they included children and young adults who are 6 months through 24 years of age. As Dr. Funk mentioned, people with underlying medical conditions who are under the age of 65. So one of the big differences between the target populations for the H1N1 vaccine and seasonal vaccine is that typically we stress the importance of giving this vaccine to the elderly. With H1N1 vaccine, people who are 65 and above are not typically who we're seeing having the most severe consequences from this. So that's one of the major differences between who is typically recommended to get seasonal vaccine versus H1N1 vaccine. In addition, the other priority groups include pregnant women and persons with underlying healthcare conditions. And I know there's one more, but at the moment I wasn't planning on speaking, and I can't think of which one it is. But.
How much of the vaccine, or the first shipment we get of this vaccine, will be able to vaccinate how many people? Do we know that yet?
We're anticipating that we may get around 35,000 doses somewhere in the first or second week of October, but we really don't have that confirmed yet. That all depends on what is available nationally. So at that point, we will have to look at the ACIP recommendations that I just named, as well as what we're seeing epidemiologically in Alaska, to determine if there should be any modification of those priority populations.
Are healthcare workers, are they in the
Thank you, that's the other group. I knew there was one more. Healthcare workers as well as emergency medical services personnel are also in that priority listing from the Centers for Disease Control.
Thank you.
Thank you.
I did want to clarify on the deaths, the two. So the woman who died in Washington State doesn't count as an Alaska death. So
Yes, she was the first one.
Oh, so she's the first one. So you're not counting the infant at this point.
We are not. We need to. That was complicated enough, and looking at the timing, that we need to confer with Centers for Disease Control as to whether this will meet the definition. We also have some viral cultures that are pending on the child in the second admission in, I think it was late August, yeah. And so obviously if those specimens come back positive from our state laboratory, then that'll decide it for certain that it would be counted, this child would be counted as one of our deaths. But if there's no indication of the child having had active influenza at the second admission, then I think that's where we need clarification from CDC.
Are there any others that are being reviewed as possible? Any other deaths that are being reviewed?
No.
Someone at work had mentioned they'd heard of one at ANMC.
These are the only ones that we are aware of at this point in time.
Okay.
This is Chris Eshelman in Fairbanks. I understand that the school district has no identifying information whatsoever about the second hospitalized child from Fairbanks. Does anyone in the room have any more information about age or school?
We know that the child is school-aged, grade school-aged, and we don't have information on the school at this time.
Is that information you might be releasing later today?
I think, I don't know.
Yeah. Well, this is Deb Erickson again of the State Division of Public Health. That is an information that we would be releasing from the State Division of Public Health. And I wanted to see, Dr. Funk certainly is available to continue answering questions, but I wanted to take a little break from the questions for Dr. Funk and let you all know that Dr. Nancy Wagner with the Fairbanks North Star School District is on the line right now, and I believe might have a statement from the school district and is also available to answer questions. And we don't have statements from any of our other partner organizations, but I also wanted to make sure that you all knew that Commissioner Larry Ledoux from the State Department of Education and Early Development is also on the line available to answer any questions you might have for him, as well as the Municipality of Anchorage Health Department and Providence. So I'll go ahead and turn over to Dr. Nancy Wagner.
Move the mics over to the thing first.
We're going to move the mic.
Hold on one second, Nancy.
We're going to move the mic over to the phone, Nancy. Okay, I think we're ready for you.
Okay, thank you very much. As Deb said earlier, this is truly a tragic incident, and we here at the school district are very saddened by this and send our thoughts and prayers to the family of the student. We appreciate also the communication that the State Department of Health and Social Services has provided us yesterday and today, and we also appreciate the support of Commissioner Ledoux and the State Department of Education and Early Development in the development of a new emergency closure regulation that we had a teleconference on earlier last week. We have attempted to communicate with all of our school district employees and board members as soon as we heard about this student death. And we have plans to provide additional support at the school site on Tuesday morning when teachers and students return after the Labor Day weekend. We'll have 2 assistant superintendents on site, and we'll be following our student